How to use. Remove the instrument and accessory box, replacing the fuse. Use a tool to pry open the top of the power switch, remove the damaged fuse, and install the spare fuse. Connecting the handles. The instrument has 6 sets of operating heads, and the interface of each part will have the recommended model of operating head. Select the operating head according to the interface recommendation. Make sure the rubber ring on the operating head is intact. If it is broken, you need to replace the rubber ring with a new one. Replacement of the bullet head. When used more than 2 million times, it is necessary to replace the bullet head with a new one. Remove the handle cable. Unscrew the handlebar. Shake it. Take out the old bullet head and put the new one in. You need that tool to pry out the old pads, take out the broken pads and magnets, and replace the new pads and magnets. If there is no damage, you don't need to replace them. Unscrew the handlebar. Take out the brush in the accessory. Insert it inside the pipe. Gently turn it around and then pull out the brush. After cleaning, dip the brush into a little lubricant and brush it on the pipe to keep the pipe lubricated. The white rubber ring on the handle bar needs to be replaced in time if it is damaged. There is a filter cup on the back of the instrument. You need to check whether the water inside is full or not before you start to use it, and the water needs to be poured out in time. Rotate and unscrew the filter cup. Pour out the water and dry it. Then screw it back. Before using, you need to check whether the handlebar has been tightened, the operating head has been tightened. Instrument interface introduction. Enter the default password 000000. Enter the system. If you need to change the password, click Modify Code. Built-in prescription and custom prescription. Built-in prescription. According to the parts and symptoms, select the treatment program that has been set. Just click Start to operate. According to the operation site, select the corresponding symptoms. According to the interface recommended operating head, select the appropriate operating head. Tap Start. Tap the switch on the handle to operate. Custom prescription. Select the site. Enter the interface. According to the interface recommended operating head, select the appropriate operating head. Adjustment parameters. Times. Range. Frequency. Range 1Hz to 21Hz. Energy. Range 0.580 bar. Tap Start. Tap the switch on the handle to operate. Apply a small amount of gel to the operating area. The operating head is close to the skin of the operating area. Tap the switch on the handle. Manipulate the trapezius muscles in slow motions or slow small circles, manipulating the diasters perpendiculars. Pain point operation through consultation and touch. Start by finding the patient's pain spots and mark it well. Turn on the device, select built-in prescription, and select according to the operation site and symptoms to enter the corresponding interface. Select the operating head according to the recommended operating head on the interface and the size of the operating part. Screw the operating head up and tighten. Apply a small amount of gel to the operating area. The operating head is close to the skin of the operating area. Start by relaxing the muscles around the pain point. It can be operated in a circular motion or in a slow motion. About 2–3 minutes. Fixed point manipulation of pain points. Fixed point operation in a step-by-step manner. A pain point is about 500 to 600 rounds. It is also possible to manipulate the pain point in a slow, circular motion. Through consultation and touch, start by finding the patient's pain spots and mark it well. Apply a small amount of gel to the operating area. The operating head is close to the skin of the operating area. Start by relaxing the muscles around the pain point. It can be operated in a circular motion or in a slow motion, about 2–3 minutes. Fixed point manipulation of pain points. Fixed point operation in a step-by-step manner. A pain point is about 500 to 600 rounds. During the procedure, it is necessary to frequently ask the patient how he feels and adjust the intensity and frequency. After the operation, let the customer move the operating part. I can clearly feel a lot of relaxation and improved pain.